Guys, hope everyone is doing good, enjoying my videos. So if you have any doubts, any clarification, anything, I would like to clear all your doubts. If you are in Telugu language people, I'm able to explain Telugu also. సో మీకు ఏమైనా డౌట్లు ఉంటే తెలుగులో మీరు కామెంట్ పెట్టేసేయండి నాకు ఇది అర్థం కావట్లేదు అని నేను మీకు తెలుగులో ఎక్స్ప్లెయిన్ చేయగలుగుతాను सो आप हिंदी लोग हैं तो मैं हिंदी में भी बात कर सकता हूँ मैं हिंदी में भी एक्सप्लेन कर सकता हूँ आप जस्ट मेरा ईमेल को एक कमेंट्स में और मेरा ईमेल में आप जरा मैसेज भेज दीजिए सो टुडे वी आर गोइंग टू लर्न essential medical terminology for medical coders as you know medical coding means the word itself leads us to medical terminology. So, what is medical terminology? If you want to become a medical coder, you should have a strong understanding of medical terminology. So, usually people tell that you can search Google everything wherever you can search and you can learn the terminology. But that is correct only. But the thing is that because of that reason, if you go into the live coding, your productivity will decrease and it will take time to finish your coding of your chats as it will take more time. So now what is medical terminology? So medical terminology is used to precisely describe the human body components. Components means like you have ears, eyes, you have bones inside our body and like a femur, tibia, fibula, phalanx, metatarsals, metacarpals. Those all come under body components. So process means how all these body parts combine and perform the functions. This illness means illness means because of these malfunctioning of these organs, you may get problems which are not good for us. So medical procedures. What do you mean by medical procedures? Like if you have appendix pain, physician will perform appendectomy. So which is a medical procedure. Here the medical terminology is appendix. Ectomy means removal of appendix. So and next one is pharmacology. So as a medical coder, you need to learn pharmacology also, which is also a very essential thing for the medical coder. Anyway, I am going to take classes about these illness, medical procedures, and pharmacology. No need to worry about those. So when you want to learn medical terminology, you need to understand two concepts. One is decodable terms, second one is non-decodable terms. So what is meant by decodable terms? So decodable terms are those terms that can be broken into their Greek and Latin word. As you know, our medical terminology, most of the medical terminology came from Latin and Greek words and given a working definition based on the meanings of those word parts. Most medical terms are decodable. So learning word parts is very important. The word parts are as follows. So first one is combining form. Word root with its respective combining vowel. Second one is word root, word origin. Anyway, don't worry, we are going to have few examples about all these things. So combining vowel. A letter sometimes used to join words part, usually an O, but occasionally an E or I. Suffix. Word part that appears at the end of a term. Suffixes are used to indicate whether the term is an anatomic, pathologic, or procedural term. Next is prefix. Word part that sometimes appear at the beginning of a term. Basically, prefixes are used to further define the absence, location, number, quantity, or state of the term. Now we are going to learn few examples of those things. So for example, your glossitis. Glossitis means inflammation of tongue. So if you observe glossitis, so here gloss is word root as we learned previously and itis is which is a suffix which is itis means inflammation. So glossitis means inflammation of tongue. And second example is sublingual. Here we have sub is prefix, lingua is word root and al is suffix. If you understand sublingual closely, sub means below the, lingua means tongue. So total it will become sublingual means under the tongue. So like this way, if you know basic terminology things, which is good for you to go further and do fast your task. And second concept is non-decodable terms. So not all terms are composed of word parts that can be used to assemble a definition. If they are decodable, it is very easy to remember if you know few basics. If we have some codes, some words like that, they are non-decodable. So not all terms are composed of word parts that can be used to assemble a definition. So these terms are referred to as non-decodable terms. That is, words used in medicine whose definitions must be memorized without benefit of word parts. Like here, initially, if we learn the suffix, prefix, we are able to identify the word. In these non-codable terms, we can't find suffix, prefix, or word root. We need to remember these words. For example, if you take cataract or asthma, here there is no suffix, there is no word root, there is no prefix. So you need to remember this all these words. These are non-decodable. So along with this, we need to know few more definitions in medical coding. We can learn as follows now. So first one is diagnosis, which is most common in medical coding career, medical coding field or otherwise. So what is meant by diagnosis? The disease or condition that is named after a healthcare professional evaluate the patient's signs, symptoms and history. For example, if the patient goes to the physician, he will evaluate the patient signs, symptoms, and history. He will finalize one diagnosis, which is a final output of his examination. So, second one is prognosis. So, similar to diagnosis, the term prognosis is a prediction of the probable outcome of a disease or disorder. So, basically, it is prediction. The physician must think what is the prognosis of that condition. So, for example, if you go to the hospital or somewhere, physician will tell after explaining our problems to him, he will tell us. He will prognose our problems. He will tell what are the risks, what are the benefits, extra things, all those things. He will explain to us, which is prognosis. So, a prediction of the probable outcome of a disease or disorder. So, if you are in medical coding, you need to learn eponyms also. Eponyms mean simple terms that are named after a person or place associated with the term. Here we have few examples. First one is Alzheimer disease. So which is named after Alois Alzheimer, a German neurologist. The disease is progressive mental deterioration. So based on the physician who invented the disease, they made it as Alzheimer disease. For example, if you take Achilles tendon, a body part named after a figure in Greek mythology whose one weak spot was this area of his anatomy. So basically, tendons are bands of tissue that attach muscles to bone. So Achilles tendon is the particular tendon that attaches to the calf muscle to the heel bone. Unlike some eponyms, this one does have a medical equivalent, the calcaneal tendon. Calcaneal tendon is a tendon which is in the heel bone. So, along with this, we need to learn abbreviations like CABG, coronary artery bypass graft, TURP, transurethral resection of prostate, HTN, hypertension, COPD, chronic obstructive pulmonary disease. So, all those words we need to learn. We have few more definitions which are essential for medical coding as we need to interpret the physician documentation. So here generally in medical coding or any medical field you find sign and symptoms which is normal word or common word in the medical field. So here we are going to learn sign and symptoms. Sign is a manifestation of disease that the physician perceives, like fever, high blood pressure, rash. All those things identified by the physician. So, symptom is a manifestation of disease apparent to the patient himself. For example, if you have pain, you will feel that is a symptom. If your pain is diagnosed by the physician, which will become sign. For example, a rash could be a sign, symptom, or both. If the patient notices the rash, it is a symptom. So, as you are perceiving that I have symptom, the doctor, nurse, or anyone other than the patient notices that same thing, this will become rash. It is a sign. So, if both the patient and doctor notices the rash, it can classified as both a sign and symptom. So, which is signs and symptoms, which is ICD-10-CM guideline. So, what is that guideline? Codes that describe symptoms and signs as opposed to diagnosis are acceptable for reporting purpose when a related definitive diagnosis has not been established, means confirmed by the provider. So, for example, patient went to the hospital with fever. So, after research, after evaluation, physician could not find the reason for that fever. So here we can code fever as a PDX. Even though it is a problem, we can make it as a assessment in plan as final diagnosis or confirmed diagnosis by the physician. Here we need to learn one more common word, mortality. So what is meant by mortality? Mortality shows the number of deaths in a particular population. It is expressed as the number of deaths per 100 people per year. It is measured with the help of systems such as Glasgow Coma Scale, etc. So, usually, wherever you see, people tell that mortality rate. So, how many people are dying due to some concern? So, we have one more word, morbidity. So, basically, morbidity refers to the state of being unhealthy. So it applies to all the people affected by a disease in a particular region. The morbidity rate refers to the number of people affected by a particular disease. This helps the health officials to make risk management and adapt national health system according to the needs of the population. So, like for example, if we have corona, so this will become morbidity means most of the people are affected by the coronavirus. So because of this morbidity, government will uh, initiate the measures to decrease the uh, deaths with this coronavirus. So one more word we need to learn, sequela, a condition that results from an injury or disease, referred to as late effects in our medical coding. Like if you have a burn, you will get the scar. So scar will become late effect of burn. So because of burn only, we have scar. So scar will become late effect of the burn, which will become sequela. One more term, acute, a term that describes an abrupt, severe onset to a disease. Acute conditions occurs suddenly. So they will not take any time to grow. They will become suddenly, like accidents. All those things are traumatic injuries, traumatic. All are things acute conditions. So now we have chronic conditions, developing slowly and lasting for long time. Diagnosis may be additionally described as being either acute or chronic. For example, if you take HTN, diabetes, asthma, these are the long-term condition which will be long for life of the people. So these are the chronic conditions. Based on guidelines, the for acute conditions time frame is below 4 weeks. For chronic conditions, of more than 1 year. Means if you have any condition that is exists for more than 1 year, it will become chronic condition. So if you have a condition, you can treat that condition within 4 weeks duration, it will become acute condition. So as per guidelines, acute and chronic conditions in ICD-CM guidelines is If the same condition is described as both acute and chronic, and separate subentries exist in the alphabetic index at the same indentation level, code both the and sequence acute code first. For example, we have you have one code that has acute and chronic specificity. So you need to code acute first, then chronic next. So next one is syndrome, a group of signs and symptoms that constantly appear together, which is self-explanatory, no need to explain.